dose of the vaccine.
I apologize. I completely forgot to start the video recording earlier.
Okay, thank you.
Of course. I saw another question, I think a hand raised, if someone else wants to chime in.
Yes, hi. My name's Candace Cartley. Thanks for taking the time to explain this to us. I had a question today. Our whole family got COVID over the Christmas holidays, and we're coming out of it. And the day that he was supposed to get his booster shot was the day he was diagnosed with COVID. And he told me he was told he has to wait 6 months to get the booster shot once he tests negative. Is that the case?
Someone else like to chime in on the booster? I am actually not up to date on the booster because our kids aren't, well, some kids aren't getting it, but I'm actually not sure about the booster question.
Sure. So I'm happy to take that one, but if you could just repeat, did you mention that this, if you could just repeat the question, because I also mentioned, I think you mentioned that they were COVID positive. I just want to make sure I understood.
Yes, yeah. He was COVID positive. He was diagnosed the day that he was supposed to go in for his booster shot. Mm-hmm. So of course he didn't go. So we all moved through COVID, and now we're back. We're not isolating anymore. But he was told that he cannot schedule his booster shot for 6 months. So
when had he completed his primary? When was his last dose of the primary series? Because that might be, there might be two factors here. So one of them, yeah.
No, I'm sorry. Well, oddly enough, he worked for Moderna and he got COVID, which was kind of funny in itself. But that was, I think, maybe in March. So he was scheduled for his second dose was in March of last year, or maybe it was September. I can't remember. I'm sorry. But he was due to get a booster. He had gotten the okay to get a booster, and he had made an appointment, and he had cleared all the hurdles around, whether it was appropriate or not. And then that's when he came down with COVID. So no booster.
So exactly. So two things, for people, the first part of your question is, I just got COVID. When can I get vaccinated after getting COVID? The answer to that is that most people, after recovering from COVID infection, can get vaccinated as soon as they're able to leave isolation. Meaning as soon as you're clear to leave your house and be around others, you can go get vaccinated. There's a very rare number of people who have severe disease from COVID, including the multi-inflammatory syndrome that I mentioned, who are hospitalized, or those who receive certain COVID treatments. They might need to wait a little bit longer. And I would certainly talk to their doctor around when to get vaccinated. They might need to wait like a few months, but most people, and it sounds like, your son might fit into that category. Most people should be able to get vaccinated right away as soon as they leave the house. So.
Okay, great. Thank you.
Yeah, it's a common, we get that question all the time.
And I don't think I had mentioned that the booster, and this is in my slides, the booster is eligible now for children over the age of 12. So even though this is designed for mostly the younger kids, if you do have a 12-year-old and it's been 6 months since their last Pfizer vaccine, then they're eligible for, sorry, is it 6 months since the last one?
So they recently updated it to 5 now. Everything's changing so quickly.
Okay.
No, it's totally people who
5 months since the second vaccine or since the first?
It's 5 months since the primary series.
Okay.
Exactly.
Okay, so 5 months after the first vaccine, then they're eligible for a booster for the Pfizer for kids over the age of 12.
Correct.
Okay. I will keep powering through. These are great questions.
Alyssa, I see there's another raised hand.
Oh yeah, of course.
Kathryn.
Please go ahead.
Kathryn Parker, do you want to jump in?
Hi, everybody. I'm Kathryn Parker. I'm with the Boys and Girls Clubs of Dorchester. And first off, I commend you for your great work. I know this has been a challenging long time. So thank you, thank you, thank you. There's been a lot of conversation around just how prevalent COVID is right now. And I'm of the age where I went to chickenpox parties when I was a kid. And so I've heard this concept come up, like, should we, just make an effort to expose ourselves and our children to COVID if someone that we know has it, or should we wait for it to occur naturally?
So perfect segue. Like you read my mind here. So I have COVID right now, as do my kids and my husband. And it's quite it is extra distressing, I feel like, given how careful my family has been. And then we were the Christmas party COVID people. So those are my two kids. Alex is 6. He had COVID in that picture. He felt like $1,000,000, asymptomatic. My daughter Zoe is 3. This was also when she had active COVID infection. She is the only one in my family of 4 who's unvaccinated. She had a fever for 3 days and a pretty bad congestion. And then my son, we only caught having COVID, as well as my husband and myself, because we did rapid testing after our known exposure to our daughter. And I interestingly became symptomatic on day 9, which is like very late considering I'm fully vaccinated and boosted. So the point being, no, please do not have chickenpox parties, meaning, which is, I remember that too from my childhood, right? Like chickenpox outside. No, please do not have parties where you expose kids to COVID. I think that what Dr. Fauci, who is brilliant, who I have so much respect for, and a lot of us in healthcare who see COVID all the time, every day, are experiencing, is that it really does feel like every single person has COVID right now. Our health center at Dorchester House, about 20% of our staff are out right now with COVID, not from the health center, from like community kind of transmission.
Sure.
So we can't have chickenpox parties and we can't have COVID parties, because for people who are immunocompromised, for people who are not fully vaccinated, for kids who are undergoing horrific treatment for cancer and other immunocompromising situations, COVID can be very dangerous. And the vaccines are so incredibly effective, but it can still be dangerous for people who have underlying conditions, or the occasional breakthrough case that just gets sick. And I'm so grateful to vaccines. It meant my 6-year-old has had 0 symptoms. It meant my husband has had 0 symptoms. And then for some reason now I have a few. But it was such a stark difference in my own family from my 3-year-old, who became febrile and pretty miserable, compared to my 6-year-old. So please don't have COVID parties.
I will spread the word. Thank you. Thank you. Yeah, it's just been such a prevalent conversation that I've heard in many different pockets of my life, work, so, family, social. So thank you. Thank you. And feel better soon.
Thanks.
Thanks.
I saw one other, sorry, I apologize for interrupting you. I saw one other question in the chat. Karen Richardson, I can read it, or Karen, if you want to jump in and read it, you're welcome to as well.
Oh, possible to get it again after the booster. Yeah. So yes. And Dr. Sanchez, feel free to interrupt here. So yes, absolutely. So COVID is tricky, right? Like, why we keep getting it is because it keeps changing and it keeps mutating, and these vaccines are not perfect. And even natural immunity, meaning you get the virus, it doesn't protect you forever. Just like how people could get flu 3 years in a row, right? It's the same kind of idea for COVID. And this is the frustrating part of this virus and why it sometimes just feels impossible. If you had COVID over the holidays, like it feels like every other person around you did, you can get it again. And we don't know, it might mutate again. We might end up with not Omicron, but something else. So you can, and it's important to keep masking. It's important to keep distance if you feel like you're having symptoms. I think, and know though that vaccines are working, meaning your symptoms are going to be dramatically less. Your chance of spreading it to somebody else is dramatically less if you get vaccinated. And a lot of people might end up just completely like having no symptoms at all, or not getting it because of the vaccine. So yes, it's possible. Nothing is perfect, but the vaccine and the booster will absolutely help prevent that from happening again for you.
Yeah, I really just want to echo that message. I think it has seemed, I think in the midst of sort of everything that's going on and everyone that's gotten COVID, it almost seems, like, are these vaccines even working? They are. I think that even people who are boosted are at less risk or are more protected from getting COVID infection. That protection is not perfect, but it is there. I can share that both my parents were sick with COVID in the past few weeks, and that had been something that I was so nervous about. My dad is older and he was a former smoker, and I had been petrified about that. And they both just had sniffles, and were thankfully feeling okay. And they were both boosted. And so I just really, again, so I just want to echo that. And I think about the sort of COVID parties that we were talking about earlier. I think another point I just really want to acknowledge and lift up is that we're all tired. We are all feeling so drained and so exhausted and perhaps hopeless. And I really just want to lift up that, I do think that vaccines remain sort of the way out of this. We're still not sure what that will look like, right? And that changes every day. But I am hopeful after this wave comes down that we might be in a different place, and especially if more and more of us get vaccinated. And so I just really want to offer, that glimmer of hope, because I think that's a part of why these ideas come to light. Is I just want to get this out of the, I just want to be done. And I empathize with that because many of us are there, but I really, I hold out hope. And I really still, as Dr. Levin-Scherz, the vaccines are perfect, but they really work. And so,
is it okay if I
get
can
through
say
this?
something? I'm
Sure.
sorry. And then, like, a lot of jobs is like, if you're not like, I had an interview for this place and they rejected me just because I said I didn't want to get the booster shot. Like, I think a lot of jobs is like it's mandatory, but I have both my vaccinations, but I don't want to get the booster shot. So that was just, yeah.
I would like to just say a couple of things on, firstly, on the COVID parties and also on your booster shot, if you don't mind. So the first thing is the COVID parties. I think echoing what Dr. Sanchez just said, the hospitals are full, and they're full with people obviously who have COVID. And so because the disease affects people differently, it's not simply a matter of just getting COVID and the assumption is that it will be mild. If you have a severe case and you have to get hospitalized, you put yourself at increased risk of not getting the medical attention that you need just because there's so many people that are in the hospital right now. And that's a critical part of the surge. So I think now is not the time to get COVID, but if you do, we hope it's mild. And to avoid it, the best thing is to have the immunity conferred by the vaccine. I'm sorry to hear that you got turned away from the job. That's very disappointing. I think that many companies are trying to protect their employees from getting COVID, and masking is critical, but it doesn't work 100%. I mean, many of us know people whose family or friends said the only exposure they had was, in the supermarket, and they had gloves on and they barely touched something. So, people get exposed, and, I think to the extent that we can protect our friends, family, community, it's really critical that if we can consider getting boosted, and I understand you have your personal reasons for not getting boosted, but, sometimes I think it's worth it to talk about them and discuss them and see if there might not be another way. So.
I have a question. Is it fair to say that they really don't know how this virus is being spread?
I can just speak to that. I think we know a lot about the virus, how it's being spread. And there have been many, many studies now demonstrating the different ways that it's been spread. It's very clear that it's spread through, it's an airborne virus. And it's spread by, getting exposure on your respiratory canals. So I don't think it's true that we don't know how it's being spread. I think we know a lot about how it's being spread, and that's why there's such a strong emphasis on wearing masks, and wearing not just masks, but not wearing cloth masks, because cloth masks are not as effective as surgical masks, and obviously the N95s are the best masks to wear, but they right now are very hard to come by.
Yeah, and I think the other piece is exactly as Dr. Hall was mentioning. We do know how the virus is spread, and that's why many of the tools that we've used throughout the pandemic, like masking and vaccines, do work. Oftentimes, we need to scale up or down on some of those strategies, like for example, masking. Using higher quality masks to offer more protection as we see a more contagious variant and as we learn more. And similarly, vaccination has become all the more important as we see more and more cases that constrain our hospital. It really is important for us to be vaccinated because we don't want to end up in the hospital right now when there is such a limited number of beds because so many people are getting COVID. So really, with these tools, we just really think about the urgency of which to use them and how to scale them, depending on the protection that we need. And I would say, as Dr. Hall mentioned, that right now we all need the protection that we can get so that we don't end up hospitalized or any of our loved ones.
Yeah, but I know a lot of people that are using all the precautions and they still got COVID and they, not sick in the hospital, but really sick at home. So, I mean, that doesn't make it easier for anyone that is not vaccinated to get the vaccine. So, I don't know.
I totally hear what you're saying, and we all know people like that. And unfortunately, I know many people who have died. And some people, even at the commission, who were wearing masks, have very severe COVID. And the thing is that if you get COVID and you're lucky enough, like hopefully Dr. Levin-Scherz and her family will, ride this one out and come through it. But some people have a condition called long COVID. And long COVID is no joke. You get fatigued, you get depressed, you have, some people, don't regain their sense of smell or taste. And it really can compromise your life. And so I just really encourage us because we can always find exceptions, but we have to look at where are there more exceptions? Where's the majority of what we're seeing? And I think the majority of what we're seeing is that people who get exposed to COVID and are not vaccinated and certainly if they were vaccinated a long time, they're getting severe disease. And when they go to the hospital, it's very hard for them to get the medical attention that they need because a majority of the people who are in the hospitals are people who are a majority are unvaccinated or not fully vaccinated. And that's the thing, I think we have to look to the majority because there are always exceptions to the rule.
Dr. Levin-Scherz, I don't know if you want to move on a little bit and we can.
I want to move on to the slide and we can see, I think that again, just when I was thinking about this as more for younger kids, I think that for all of us, and now as a parent who's been going through the quarantining and not sending my kids to school, another big incentive, honestly, to get vaccines is, man, does this make life easier for schools and keeping our kids in school and keeping schools open? The amount of mental health and anguish that I have watched kids as young as second grade, not usually kindergartners, but definitely as young as first, second grade go through related to the year of not being in school is pretty awful. And so I also think that that's a big reason why parents should be getting their kids vaccinated. It's because it really helps kids stay in school. And if they're exposed, it helps prevent kids from not being in school. So the Department of Early and Secondary Education put out a policy on New Year's Eve. Close contact. If you're a fully vaccinated child in school, you do not have to test and you don't have to quarantine if you are fully vaccinated and you don't have any symptoms. That is huge, right? We are seeing COVID everywhere. We just are. It's literally everywhere. I'm curious what my kids' school numbers are going to look like this Friday when they come out. I'm sure they're going to be really high. If you are fully vaccinated, we are saying, and the Department of Early Education and Secondary Education is saying, you do not have to be at home. You don't have to quarantine. If you are not fully vaccinated as a child and you come in close contact, right, whether it's at school or at home, you have to quarantine for 5 days. You need strict mask use when you come back. And then ideally you have a COVID test that's negative on day 5. It's not required yet, but it's recommended. As a parent who has just watched my kindergartner not go to school for 5 days for his asymptomatic, meaning he never had any symptoms of COVID-19, but I knew he was infected, it was terrible. And I feel so lucky that this is the first time my family has had to not go to school because of COVID. Like, I haven't had to take him out of school for quarantining or isolation up until this point. I'm sure many of you in this room have had to keep your kids home because of quarantine, because of the COVID infection themselves. And if your child is fully vaccinated, then they don't have to quarantine if they have a close exposure. And yeah, so that for me is a big reason to get our kids vaccinated and keep our schools open. Classroom close contacts are coming up all the time. I wouldn't be surprised if some of this policy changes, but if fully masked in the classroom, which all of our kids should be in Massachusetts, then they don't have to test and quarantine. And the same with buses. If it comes up while a kid's on a bus and one of their bus people that they ride the bus with is diagnosed with COVID, if the child is masked and the windows are open, they don't have to test. If a kid becomes symptomatic, then obviously they should get a COVID test. And like I said, every school has been slightly different, but in general, this is the policy. Hopefully, I mean, it might change, we don't know, but as of right now, this is what it looks like in a very, very broad sense. And again, fully vaccinated children who have a close contact and are asymptomatic can just return to school. Also, for a lot of us who have younger kids or what's happening next, there's no vaccine for kids under the age of 5, right? And that has been soul crushing as a pediatrician because we vaccinate our kids all the time for so many different things, and to not have a vaccine offered for this age group of under 5, especially the kids who are around age 1 who are more likely to end up in the hospital, it's been really hard and very sad for a lot of us as pediatricians and parents that this hasn't happened yet. Pfizer is the one that's approved right now for kids age 5 and up. Pfizer and Moderna are submitting their data in March, it sounds like. And so maybe there will be a vaccine in the late spring for our kids under the age of 5. I think a lot of us in the medical community were kind of sad and surprised that in December, Pfizer said that they weren't going to be able to submit their data and get a vaccine for this age group in January or March, or January or February, because the vaccine the dose that they chose for the younger kids was safe, but not effective. And so it didn't prevent enough of the illness. And so they're reworking their trial. But anyway, so it's not something that we have right now, but I do hope that for parents who are here tonight who have younger kids, it's going to happen. Don't go and have a COVID party and get your 3-year-old sick. It's not worth it. The chances are they'll be exposed at some point, but hopefully they don't get sick from it before a vaccine's available.
Excuse me.
Please, yeah.
I have something to say about that though. With that being said, yeah, I have a 4-year-old and I have a 16-year-old about to be 17, the second one 11, about to be 12, and I have a 4-year-old. So we all in the house are fully vaccinated, except for the 5-year-old. But I won't allow anybody to come in my house, period, because I'm so strict. I don't go to parties. I don't do none of that stuff. But it's scary because my child is going to school. That's my only concern. But I'm not in fear. I don't live in fear because, I go to church and, I repented. I'm sorry if I'm saying all this, if nobody don't want to hear it, but that's just the truth. I pray over my children. And ever since the pandemic started, my kids been protected because I pray over my children. I got praying grandparents that pray over us all the time. So I'm kind of glad that we didn't catch it. Not saying that you're not going to catch it, but I'm glad that we haven't caught it. But I'm being very careful because I feel so bad because you and your children caught it, but I just wanted to say that I will keep y'all in my prayers, okay? I am so sorry that you're going through this stuff.
Oh, that's very sweet. Thank you.
I'm
And I have to say though, but for me, this also shows the importance of the vaccine, right?
Oh, yes.
Because
Of course.
yeah.
I'm definitely gonna
Yeah.
get her vaccinated because yes, of course. So
Good.
when
And I
she hits
think that
5.
you bring up that really, and so thank you for sharing kind of your view on this, because I think that there's two really important things here. One is that there's a lot, I mean, to Dr. Hall's point, right? Some people get really sick and some people don't, and we don't really know why. And science tries to figure all this out. We don't always have the answers. We know vaccines work. So we know we do, that we know that they're working. And we also know that as parents, we're constantly balancing a risk of whether or not we send our kid to school or whether or not we don't, right? This is I mean, I have the goosebumps. This is a constant battle and that risk benefit that we all deal with every day. The more adults who get vaccinated, the more kids age 12 to 17 who get vaccinated and then boosted, the more kids age 5 to 12 who get fully vaccinated, protects our younger kids who are not yet eligible, protects our older people who are immunocompromised, protects our kids who are not eligible for the vaccine for other reasons. The benefit of school is so overwhelming for so many children that as parents and as physicians, and the more we could do to get kids vaccinated and stay in school, and then also therefore not have our younger kids be so sick because there's not as much COVID around because everyone is vaccinated, the better off we are as a community.
Yeah, I really just wanted to lift that up, and just, I really commend, I think, a lot of the points that you mentioned, right? You've taken all of the measures that you can. And I think that's what's critical is that, while one of your children isn't eligible, you've surrounded them as much as you can with people who are vaccinated. You've also protected them, to sort of, people who might be higher risk in your household. So, I think a lot of this is, you really have. And I think these are the types of measures and protection that will allow us to resume the type of activities like school and others that are critically important for our kids and for ourselves. And so I really thank you for sharing that with us and commend the protection that you have offered.
Oh, I have something else to say. I'm sorry. I know this is not a BPS call, but I mean, about the kids sitting next to each other. But I just wanted to know, like, I was told, like, there are some kids, I mean, there are teachers that have kids sitting on a mat and they so close together. I thought the teacher's supposed to have them social distance.
I mean, we generally do advise, for there to be a certain distance, 3 feet if feasible. We also recognize that all schools are a little bit different and that oftentimes with certain classrooms that might be harder. And so we offer many strategies to schools when we think about, mitigating COVID, and that often includes masking, includes distancing, includes testing, as well as like vaccination, because we know that every setting is different and you need kind of, it's like the Swiss cheese model. You need many different strategies in your pocket to really mitigate. So thank you for sharing that.
Yeah, because that's scary for me because I'm sure there's a lot of parents that are worried about that too. Some, about, if they're spread it out while they're sitting on mats and stuff like that, because, you can't help that kids sit together, they're kids. But yeah, so I mean, okay, so hopefully they are going by what they say they are doing.
I see that Lydia has had her hand raised for quite a while. Lydia, did you have a question?
Yes, kind of a question and a comment. So I have a situation where I have an underlying health condition. It's called autoimmune hepatitis. So my immune system is overactive, and for some reason it targets my liver. I guess it's like my liver, according to my immune system now, my liver basically is not supposed to be in the body, because your immune system is to attack things that don't belong there, like sicknesses and things like that. So I've been on medication. It's been 5 years. This past Christmas Eve made 5 years since I got diagnosed. Now my question is, I have been around a lot of people. I've been protecting myself and my family. I have all my shots. I got my booster. All of a sudden, they scheduled me for a 4th booster shot coming in March, which is surprising to me. The thing is, everyone that's been around me, almost everyone that I've been around doing meetings before we kind of knew about COVID, before it showed up, they've gotten sick. I haven't gotten sick with COVID, thank God, but my symptoms with my rare disease is just like COVID symptoms. So my liver specialist and my other specialists and doctors are kind of like, well, you know, just keep doing what you're doing as far as distancing yourself, basically what I was doing when I first got sick. So the mask and distancing myself from people is nothing new because people can get me sick, basically. Recently, I traveled and I was on one of those Delta flights that came back in December. I was on one of those Delta flights. And so I got tested just to protect myself, to be on the safe side, to make sure I was all set. My test came back negative. But now, people that's been around me since I've gotten back, they were diagnosed with the COVID. So my question would be for either Dr. Hall or Dr. Sanchez. Is it possible that I could be asymptomatic and not knowing it? Because I am on certain medications that I found out through my doctors, they already were starting to give people who have COVID, like such as some of the steroids that I'm already on. Because my test keeps coming back negative, and now my mom has it, my sister has it, her daughters, my nieces, they stay with us. They just got their shots, but we're worried about them getting it because they just got their shots last Friday, their first shot. And also my other niece, she got her shot, but she came back negative, and now her mother has it. They were all around me.
Daily admissions from hospitals, there may be just one, and the lack of open spots.
I'm going to defer to Dr. Sanchez.
Sure.
But I just want to say that, you know, there are some, and it's not, the tests are very reliable. And the kind of, the antigen test is slightly different than the molecular test. And they're more accurate at different times. I think that one of the guidances, though, is that if you've known that you've been exposed to someone with COVID, you want to wear a mask and do social distancing. And it might be a little too late for that now. And you know, I think over time you don't shed the virus as much, even if you had it. And so getting a test at this point, I don't know the number of days that you've come back.
Well, when I got back December 20th.
Okay.
And that following Friday was when the breaking news of all the Delta flights and United Airlines flights came out.
Yeah.
So my doctors had contacted me already and we got tested. I got tested that Monday.
Yeah.
But everything came back negative. So
Right. Yeah.
because of my situation, you know, it's like my doctors are like, you know, we don't want to test to see if you're asymptomatic, but I'm on so many different medications already. It's like, it makes me wonder if would they be able to tell or not anyway. Because
Right,
like I said,
right.
now
Mhm.
my sister has it and I had to quarantine. I got a letter from Department of Public Health. They told me, even though your test didn't come back positive, we still would like you to quarantine for 14 days. So I still stayed away from everybody for 2 weeks, quarantining. And now this just happened this week and this past week with my family.
Yeah, I mean, I think that even if you, and I should let Dr. Sanchez speak here. I just want to say that if, for instance, you came back and you know, somebody in your family, in your circle got COVID from you, which is, you know, it happens every day, every hour, it's happening right now. Then they become the people who are, you know, contagious. And so whether or not you were infectious at the time or not, well, certainly not now, but is not relevant. It's, because you've passed it on and the people around you are then passing it on. And so at this point, there's not much to be learned from the tests, but I'll defer to Dr. Sanchez if she wants to add anything to that.
Sure. I think the only thing I'll add, Dr. Hall, as you mentioned, sometimes our tests work incredibly well, and sometimes it's also just all about the timing. And so it might, it's possible that you might have gotten infected. It seems unlikely if you got tested multiple times, but we won't know. I think the important piece is, to take the measures around sort of protecting, after an exposure, to take the measures you need to sort of protect to mask yourself and protect others around you, and just for the people that you mentioned to also sort of protect themselves and take those same measures as other people in their households become positive. I think that's really, oftentimes we never know. There's never a certain degree of certainty around these tests.
Oh yeah, definitely. I just wanted to see what you guys input would be. Like I said, I take precautions anyway for the last 5 years before COVID showed up because of my situation. So, people have been knocking on my door. My daughter's like, no, get out, get away. So now, especially now that we know my mom, because we're trying to figure out, well, how did they get it? But it's like, okay, just don't come to my house because I don't want to be rude, but you will be standing outside. So
thank you. There's a lot going around. So, I think right now the rate of positive tests is 1 in 3 about. So that means that 1 in 3 people who are getting tested have a positive test. So there's a lot of COVID around. So there's a lot of opportunities to get it.
I just want to, I'm just also looking through the chat. I know there's a lot of great questions here. Does the, I understand there's a teacher on the call who had some questions about the elementary school teacher. Great. Do you want to share your comment? And also thank you. I think you have an incredibly hard job right now. So thank you for teaching our kids.
Yes.
We can't hear you, Chris. Is Crystal talking?
I'm also having trouble. I don't hear her either yet.
I can hear.
You can hear Crystal?
I can hear you.
I don't think anyone else can.
Uh-oh.
You have special powers.
I think she's on the language line, and that's possibly we're not hearing her. But she said she did write a comment in the chat. I think someone had previously asked about guidelines in schools, and she said she is an elementary school teacher, and she wants everyone to be assured that teachers are being held responsible for following the CDC's guidelines and are doing everything possible to keep the students separated and safe. So thank you, Crystal, for sharing that. I apologize that we can't hear you.
Also, another comment was just about question about allergies. If you're worried about you having an allergy to a component in the vaccine, or your child has a history of an allergy, in general, the COVID vaccine has been safe. If I would encourage you to talk about specific cases to vaccine reactions with your pediatrician. And I've been sending patients to an allergist. I've only had one patient of all of my panel who developed hives, which we think may have been linked to the vaccine. And so she'll go to an allergist before getting her second dose. But otherwise, so if you do have questions, then allergists are ready and waiting to see patients to make sure everyone's getting vaccinated.
I know, Carrie, you've had your hand up for quite a while. Do you want to ask a question?
Yes, please. Thank you. Because I posted a few times in the chat, and somebody else even asked, and the question has yet to be answered. Where, or do you know of any places that are giving out the in-home tests? It seems like it's like this big secret, and sometimes you find out like after the fact, or whatever, or people are like, oh no, we're not giving them out, and then somebody will tell you like, oh yeah, they're giving them, like, huh? Like, so is Dorchester House giving them out, or like,
so we're gonna send out an email after this. We were hoping to give them out in conjunction with this conversation, but I I actually have COVID right now too, so I wasn't able to go into the office to hand them out. But I'll send a follow-up conversation with a date about days that people can come and pick them up at Dorchester House if they want. It will be hand sanitizer, at-home test, and a mask if people want to come pick them up, but we'll send out a follow-up email with that date. The city was releasing at-home tests to nonprofit organizations in Dorchester, but they were doing it at a rollout basis. And so some organizations that we were partnered with received them, but they go very, very, very quick. So we're hoping to get more in the future, but right now we don't have any more than we have allotted for this event, but in the future we do hope to get more.
Okay, so are you the only one who's gonna be giving them out? So we have to wait till you get better to go in?
Well, I also,
So is that what the thing is?
go ahead, Kayla. I'll add something afterwards. Go ahead.
Yeah, so I'm the only person at Crossroads. I'm a one-person organization. So yes, unfortunately, yeah, you do have to wait for me. But
Okay.
I'm hoping my quarantine will be over next week, and I'm hoping to be able to release them on the 25th. And if people need them before then, they're welcome to go into Dot House to get tested with these dates here.
Are you sending them? Okay.
Also, the White House is going to be sending out COVID tests starting next week.
The White House?
Yes, from the
Okay,
White
is that
House.
just like the stimulus check, where some of us didn't get them? Okay.
I'm not sure. So they're starting it by zip codes. So I know that all the zip codes along the Blue Hill corridor are on their list of priority neighborhoods that will be receiving the tests first. I think we will be receiving an email on Monday on how to access those tests. It will be like one box per household, and they'll each have 4 tests per box.
Okay.
I will send out that information with a follow-up email after this call. Once I have the email, I believe it will be on Monday or Tuesday. We're getting like a priority message about it, and we'll make sure that everyone on this call gets that information. But again, it's the White House. I'm sure everything will go really quickly. The servers will probably crash. It's not going to be, the best solution, but it is, I just want to put that out there that is coming up.
All right, thank you.
Sure.
I also know that health insurance plans are going to start requiring, are going to start covering the at-home testing. So it'll probably be plan specific for how to submit for like getting paid back for buying them, for example, but per person will be allowed 8 at-home tests per month that will be fully covered by health insurance by law starting this week. So again, the access issue has not been figured out, which is incredibly frustrating. But in terms of payment and hopefully making things more accessible, we're finally 2 years into it, moving in the right direction.
Yeah, and if folks have the means and can front the cost before the reimbursements happen, I do know that I have found them on walmart.com as well as sometimes walgreens.com as well for purchase, but they are really expensive. So I just want to flag that as well. I see we only have 15 minutes left. I did put in the chat, Kayla and I both put in the chat a little feedback questionnaire if folks could take a couple minutes to answer that at some point. And I don't know if you want to finish your slides, Dr. Levin-Scherz. No,
Marianne, I just want to say a few things, if you don't mind, because I have to head home. But I wanted to say thank you so much for inviting me. And it was really a pleasure to hear some of the voices of people in the community, because sometimes we don't get out, especially with COVID. Nowadays, it's so hard to be out and about. I wanted to say that we will also be distributing test kits once they're available. And that we have made a video about how to use a test kit that we're happy to share. We can send the information to Mariana, and we'll also can share any other resources that we have. I think that it's been a tough time for everybody, but it's really wonderful to see people surviving and thriving, even though we're still being challenged by COVID. So have a great evening again, and thanks for inviting me. Take care.
Thank you as well.
Bye-bye.
Thank you so much for coming on.
Thank you. Bye-bye.
Beverly, I see you have a question. Did you want to ask the group?
Yes, actually it was a comment, and that is that when you're giving out the tests, you know, usually there's a very, very long line and you have to wait and wait. And I'm disabled, I'm on oxygen, and I'm homebound. Does anybody think about how we might be able to get some of those tests? Because
Beverly, I wrote you a message in the chat, but I'm more than happy to deliver them to your house if you just send me an email. I just need your address.
Okay, so where would I put it in the chat?
You can either put it in the chat or you can email it to me, whichever is easiest for you.
Okay, well, do I have your email?
Yep, it's in the chat.
Okay, I'm new at this, so
That's okay.
All right.
I can, and when we send an email, I can put the information in there too. Okay, we'll send an
All
email
right,
in a couple of days with some follow-up information.
I don't even see the chat. Oh my goodness.
Hold on, I'll rewrite it. Okay.
All right. I'm just trying to find it.
If not, you can just stay on at the end of the call. We'll make sure we get your information.
That'll be easier for me. I'll just stay on.
No worries.
All right, stay on
Thank
and I'll
you.
get it. I'll get your email.
Thank you so much.
Ramona, do you have a question? We can.
Yeah, we're not ignoring you, Ramona. Come on.
Never.
Okay, so okay. My question was, like, I hear a lot of questions about does the shot prevent I hear a lot of people say around here where I live at sometimes, like, does it prevent you from getting the COVID? Like, does the vaccine, like, have you fight against the COVID? Things like that I was hearing. I just wanted to know, like, was that true or not?
Yes, the vaccine can help prevent you from ever getting COVID. And if you do get COVID, for many, many, many people, it will prevent any symptoms of COVID. And we know also helps prevent you from spreading COVID to others. If you're vaccinated, it can help lower the amount of virus and lower the chance of spreading it to others. But yes, the vaccine can actually prevent you from getting COVID.
Oh, okay. Oh, I didn't know that y'all talked about it. Somebody said something.
No, that's fine. I'm seeing in the message some questions about that, about my statement that you can still spread it. Yes, you can still spread it, which I think has been confusing and complicated for a lot of people because a lot of people who are vaccinated don't have symptoms of COVID. So yes, you can still spread the disease even if you're vaccinated and even if you don't have symptoms. You are less likely to get COVID if you're vaccinated, and you do have less virus that's kind of in your nasal passageway down into your throat if you're vaccinated, and less likely to spread it to others. It's incredibly important to still mask when you're inside crowded areas. I fully support mask wearing, like, all the time. I never go into a store without it. So I don't think we're there yet. And I think a lot of people, and especially other parts of the world, think we are, but we're not. So I still wear a mask. Most of the doctors I work with still wear masks inside. I think my kids should still be in masks in schools. I think all that makes sense because you can still spread it. But we're getting there. And the way to get there is by getting vaccinated. Yes, Nadine, it looks like you have a question.
Yeah. Yes, I get it. Are you gonna send this information out to somebody else? But
Harry, I'm gonna mute you really quickly so Nadine can speak and then we can get to you afterwards.
Hopefully you won't die.
Oh, it's not letting me mute her. Sorry, Nadine, go ahead.
Are you gonna be sending this information out to everybody regarding the COVID test? And I'm like, somebody else had said this too, that I really need somebody maybe to deliver them to me.
Yeah, we will send out all of the information. We're going to send out a resource list with all the places that you can get tested and vaccinated after in the coming days or potentially next week, but as soon as possible. we will send that out to everyone. Since you had to give us your email to join the call tonight, we have all of your emails, so we'll send it out to your email as soon as
Okay.
possible.
What I'm saying though, okay,
Mhm.
between the lines, I need somebody to deliver this to me.
We're able to do that. When you registered for the meeting, did you give an email?
Yes, I did.
Okay, so we can follow up with you via email.
Okay, or either I can go into one of the hosts and put my phone number there or whatever, but my email,
Okay.
you have my email.
Okay, you can send me your email if that makes you if that's easier. My email is in the chat, but I'll write it again, okay?
Okay, and you're Miss Kayla,
Kayla.
right?
Yep.
Okay, I will do that. Thank you.
So we have about 7 minutes left, and I want to make sure that we have time to answer everyone's questions.
Terry, I don't know if she's still here, and I know she was trying to ask a question, but she might have left. Yeah, I don't see her anymore.
And then just reading through the chat, it really does seem like access to testing and masking is a huge issue. And this is not unique to Dorchester, it's everywhere. But I think that's great, guys, if you'll send out information about how to get test kits available. And I also know that that they will be mailed through the US Postal Service like very, very soon, like in the next few weeks. This is a huge initiative and huge undertaking, but they will start being mailed out to people through the US Postal Service. And so I can make sure you guys have that link too, because I think there's a way to start registering for that. So I can send that along to you guys, but I hear you. And the testing lines are long, and we field these questions all day long in pediatrics. So please bear with us if you're on call, if you're on hold for a long time trying to figure out COVID testing. We're all in the same boat with you, and we hear how hard this has been for everybody. And I know Dorchester House is doing their absolute best, as are the other community health centers, to really offer more access for testing. So thank you guys for being patient, and we're all trying. I do see that just a nice reminder up on the screen for those looking at the screen, what to do to help prepare your kids for the vaccine. Honestly, this is no different than any other vaccine that we give in pediatrics. It's an incredibly small needle. My son, who is very, very, very anxious about vaccines, did not flinch when he received this vaccine. I was like, wait, it's over, which was amazing. He actually got it at Dorchester House. I cried. It was wonderful. But I also, I give my son, because one of our nurses here at Dot House taught me this, I give him an ice pack. It makes him feel empowered. So I have him put an ice pack on his arm first, and I don't think it does anything, but he seems to like it. So you could try that with your kids. And we absolutely do that in peds if we're worried that patients are really going to freak out. Sometimes that helps just to give them something to feel empowered. But it's no different than any other vaccine. And they've all gotten a lot of vaccines at this point. So we don't do it. There's nothing special that has to happen with the COVID vaccine. It should just be a really exciting day, because it's one step closer to ending this. And at least that's how I phrased it in my house. And it was really, really exciting. And my 3-year-old tells me her arm hurts from her COVID vaccine sometimes. I'm like, Zoe, you didn't get the vaccine yet. But we do talk about it a lot in our house.
And I think one of the important things, it's really about making it whatever works best for you and your child. Like my son, he listens to Earth, Wind, and Fire every time he gets a shot. And that's that's his routine for when he gets his vaccines. He has to listen to September by Earth, Wind, and Fire. The nurse who gives him his shot doesn't remember his name, but she calls him the Earth, Wind, and Fire boy. So, you just have to find something that makes it's important that you feel comfortable too, so that you and your child both feel comfortable when you get the vaccine. So if it's saying well, after you get the vaccine, you can get a popsicle, or after you get the vaccine, we can watch a movie together, find something special that makes it a more memorable experience for both of you and makes you both comfortable.
And then just reading through the chat again, it really does seem like the access issue, it keeps coming up. So we'll keep working on that. people who don't have good computer skills or availability for technology. So we will have testing kits available at Dot House. I think as we get more access, again, we'll start being able to give them out again to patients. Where can we purchase KN95s or get them? Are there other sites other than the place on Blue Hill Ave that you guys know about, or we'll be able to send out? No.
I know about surgical masks, but not the N95 masks. I don't know if anyone else knows about these ones.
Yeah, we're giving out N95s on Blue Hill Ave, but I don't know if anywhere else. But 236 Blue Hill Ave, Tuesdays from 4 to 7. We are doing, we have a vaccination clinic and are doing PPE kits that include KN95 masks.
And those are reusable, just for everyone to know. So they're okay to use until they look soiled, basically, is an okay way to think about it in terms of using the KN95s. They don't have to be single use as long as they still look clean.
So our site is really not crowded. I see Gloria put that in the chat. It's really, really, really short wait times. It's a really small clinic. Amina, feel free to pipe in, but it's usually like a 5-minute wait at most. We can definitely get you a mask immediately. No wait time for a mask.
Yeah, it's a longer wait, and I'm sorry. Dot House is a longer wait, but thanks for those who do wait.
To add, yeah, we're usually on the outside, like handing out the masks at the beginning. So if you just like walk by, we'll just end up giving you one anyways, a PPE kit with mask, hand sanitizers, and gloves.
What days and times?
It's on Tuesdays from 4 p.m. to 7 p.m. So this Tuesday will be there 4 p.m. to 7 p.m.
And what's the name of the organization?
Thank you.
It's called The Muse. That's the name of the building. Unfortunately, it doesn't have a sign. So if you look it up on Google Maps, it'll show as the old dry cleaners because it hasn't been updated yet. So if you do look it up, it'll show as a dry cleaners on Google Maps. But I put the address in the chat. It's very close down the street from the from Wings and Tings, if you know where that is, and close to the Mecca Shopping Center.
That doesn't help me, but thank you.
Are you familiar with Grove Hall?
No, I'm not in Grove Hall.
Okay.
So I don't get out very much. So but all right, thank you.
Who is this speaking? Sorry, I can't see.
This is Beverly.
Okay, Beverly, I'll email you.
All right, please do.
Okay.
Thank you very much.
So I wanted to say it's 7:30 now, and I wanted to say a huge thank you to everyone for coming on tonight. A huge thank you to Alyssa and the other doctors who came on tonight to talk with us, and to Crystal for coming on to translate, and for Mariana and Amina for helping host this. Thank you for everyone for sharing your questions and being so candid with your questions and your concerns. And we hope to see you guys again. I know that we put in the chat if you guys are interested in coming to future community conversations or have suggestions about future topics. We do suggest that you share those. I know that some people right now are saying that they're interested in the 15-hour class. That's a different organization doing that. It's called Tech Goes Home, but I can send out some information to people about that too. But we do hope that people come to our future conversations and that you follow us on Instagram. Our information will be on Instagram from this conversation, and then we can send out some of the information that we talked about tonight as well in the email that we send in following up.
I'm also happy to share my email. I just put it in the chat, and you guys are welcome to hand it out. I thank you guys so much for inviting me tonight. I am so passionate about this vaccine. I've conferenced into 2 of my family's dinners to talk about the vaccine over the phone when there was all the family around. So I could, sorry, my patient's family, not my own family. So I could like tell them what I thought and answered questions. So if you guys ever want me to talk to other family members or talk to you guys again, I'm more than happy to, and more than happy to answer questions. And I hope that you also feel comfortable asking your child's pediatrician similarly, because we all really care about this.
And someone just asked about food, and I put in the chat a link for our food resource guide, which is updated every week for food resources in certain neighborhoods of Boston. So please check that out if you are in need or want to share it out to anyone else. And I want to thank Kayla for helping host this talk, as well as everyone else for joining, and Dr. Levin-Scherz for being here. We will be sending out a follow-up email, so keep your eye out for that. And yeah, thanks everyone for being here tonight. Have a good night, and please stay safe and healthy.
Thank you.
Thank you so much. You've been very informative.
Thank you.
Thank you.
Thank you.
Mariana, sorry, there's someone named Janice on who's speaking in Spanish, and I speak very, very bad Spanish. I know it's Spanish, but I don't know what
Is she messaging you?
Yes.
Okay.
She might have logged off.
Do you want to send? Oh, you can send me her message.
Do you still need me? This is Beverly.
Beverly.
Yes.
You need.
Who did she say? Janet?
No, it was Janice. Sorry, Janet.
Okay.
Beverly, we have your email address, so we can send you the information. Or Kayla, do you want to connect now?
Yeah, Beverly, I can see you. I can send you an email to follow up about figuring out how to get you some supplies and what you need.
Okay, and the links, I'm not real good with it, but I did find the chat.
Yes, you did.
I'm so proud of myself. I'm overjoyed. But you put in the resource guide. Could you send me just all of that at one time?
Yes, absolutely.
And the 336, what is that near? I don't know where Wings and Things is, you said?
It's near the Grove Hall Mecca Shopping Center. It's 336 Hill Ave.
Okay. All right. Well, thank you very much. I really enjoyed it. It was an excellent meeting. I learned a lot.
I'm glad.
Please add me to your email list.
Okay, we will. Thank you so much, Beverly.
Thank you. Talk to you soon. Stay safe and healthy.
You too.
Bye-bye.
Janice Thomas. Janice, I see in the chat that you're looking for Spanish classes. Are you looking for ESL classes, or are you hoping to speak to somebody in Spanish?
I don't think she's here, Kayla.
I don't think she's here.
Oh, she just wrote me a message in the chat. Oh, she's gone. Okay. That was weird.
Okay, are we good? Do you want me to?
But thank you guys.
Thank you so much, Alyssa. This was
Oh,
awesome.
wait, this is
Really
so
appreciate
confusing. Can you hear Crystal?
No.
No.
Oh, I can hear her. Okay, hold on. This is very confusing because you guys are talking at the same time. Hold on. Oh. Oh, yeah, this isn't good. Hold on 1 second. Language and okay. Crystal?
Yes, I can hear you.
Okay, I can't hear Crystal anymore. I can hear Mariana now. Sorry.
Wait, now I can hear you, Crystal.
You can hear me?
Yeah.
So I clicked on the globe, and so I was hearing Crystal and Mariana at the same time, but you were talking at the same time.
So yeah.
Sorry, did you have your hand raised?
I don't know what happened. I'm really sorry, Crystal, but I appreciate
No,
you being
here. So Kayla checked for me in the Spanish room, and like they could hear me. So that works. And I think that Kayla could hear me because she clicked on the globe, but since you guys didn't have the globe, like didn't click on the globe, you couldn't hear me. I'm not quite sure what happened, but they could hear me. And Kayla, the person who wrote you, I had told them about when I was interpreting for Beverly, what Beverly was saying, that you were the person to reach out to. So when you said you got that long message, that might have been what it was about, because I told them that you were the person to contact. But I did say that you would be sending out information and they could respond to your email. So that might be what she was writing you about.
Got it. Okay. Well, so you were able to, some people were able to, you were actually interpreting for a couple people, which is good.
Yeah.
Good. I'm glad. I'm glad that worked out. Okay. Okay. I'm gonna end the call unless Kayla, do you need anything else? Okay. All right. Well, thank you everyone. And have a great night.
You too.
All right. Bye-bye.
Have a good night.